Well, good afternoon and welcome to today's USA Return to Campus Town Hall meeting. My name is Dr. Mike Mitchell. I serve as Vice President for Student Affairs here at South Alabama. It's right at 4 o'clock here in Mobile, Alabama. We realize that many of you may be joining us from different parts of the country, and we're so glad to have both parents and students join us on today's Town Hall as we transition back to campus for fall of 2020. We realize that there are a lot of questions from parents and students as we return to campus, and we wanted to provide this opportunity this afternoon to try to get as many of those questions answered as possible. This webinar Zoom today is in a webinar format, which means that you're able to see the panelists today. You're not able to see each other, but we have opened up the chat format for you to be able to ask questions of today's panelists. What we're going to do today is to present about 3 to 4 segments of today's Zoom and then give you the opportunity to ask questions in the chat. And so what we're going to do today is to introduce our panelists, and in those segments, give them an opportunity to spend a few minutes covering some information in their particular topic areas. They'll take some questions in those topic areas. And then if we have some time at the end, we'll take some general questions from the chat and give you as parents and students some time to also submit some more general questions about the return to campus as we get closer to the first day of classes here in the fall. And so we realize that we won't have an opportunity to answer all questions today, but we will at the end of today's webinar Zoom provide the link to the reopening website, which has tons of frequently asked questions for you to get a lot of those questions that you may have answered. Again, if we don't get all of the questions answered today, we want you to feel free to reach out to us here at the university to get those questions answered. And so let's start first by introducing our panelists today. And so our first panelist is going to be Dr. David Johnson, Provost and Senior Vice President of Academic Affairs. Our second panelist, Dr. Chris Cleveland, Assistant Vice President for Auxiliary Services. Up next, Dr. Julie Estes, USA COVID Response Coordinator. Following Dr. Estes, I've got Mr. Ryan Ferguson, Director of USA Health and Student Health Center, rather. I want to give you a larger title, Ryan. And today also joining us on the call, 2 very important folks who have done a stellar job for us. Ms. Diana Nichols, who is the Director of Creative Services over in Marketing and Communications, and Dr. John Friend, who's the Director of Counseling and Testing here at the university. Both Diana and John have served as co-chairs of our Social Norms Committee, who's been working hard to develop opportunities for our students and university community to help support the transition back to campus and make sure that we're able to return to campus safely through all of our initiatives of returning back to campus. So thank you, Diana and John, for being here today. Diana and John are going to be monitoring the chat feature today. So they're going to be monitoring your questions and taking and making sure that they are looking at your questions and asking the panelists your questions today. So they're going to be on top of your questions today as you ask them. So please use that chat box to submit your questions, and Diana and John are going to be looking at those questions. So before we get started today, I want to take this opportunity to introduce someone who is a very, very important part and has been an important part of leading this transition back to campus. Our university president, Dr. Tony Waldrop, to make some comments to the folks who've joined us on the Zoom call today. Dr. Waldrop, would you please make some remarks to the guests this afternoon? You're muted, Dr. Waldrop.
Tony, you're muted. Thank you, Dr. Mitchell, and thank all of you that are participating in this today. We really appreciate the opportunity to try to answer all your questions. And I do want to say something about the plan itself in general. As Dr. Mitchell has already said, you can find it on the web, and the easiest way to find it is just to type in the URL for the home page, which is southalabama.edu. And that you'll see that there's plenty of documents, frequently asked questions, and others. So I would urge you, if you've not looked at that already, please do so. Our plans for developing the campus were developed by a series of committees and subcommittees. We had an executive committee that really, in the end, and still are doing, going through each of the plans that the subcommittees developed. And I'm sure that if you ask any of the people who were involved in the subcommittees, they will tell you that we were a very thorough group, and sometimes it got sent back 2, 3, and even 5 times before it was approved by the parent committee. We were fortunate that we have a healthcare system and that we had physicians from USA Health. We had someone that has set up our contact tracing for us. And as you'll learn more about today, we've partnered with the University of Alabama so that students can get tested when they arrive on campus, or even before if they choose to. What we've put together is a living document. That is, as conditions change, the document will change around it based upon what the conditions are. That means that if you're concerned, you might want to take a look at that first to see if we have addressed some of those concerns. This has been a process that's taken hundreds of hours, involved lots and lots of people. And I'm very grateful that everybody pulled together and worked very hard to create what we hope is the safest plan that we can possibly have for campus. Thank you very much, Dr. Mitchell, for letting me speak, and welcome people here.
Dr. Waldrop, thank you so much for being here this afternoon, and we appreciate your leadership as we prepare to return to JAG Nation. I have to ask for forgiveness already this afternoon. I forgot one of our panelists. Mr. Scott Weldon is our Vice President for Finance and Administration, and he is also here to entertain any questions that might relate to his area as well. And so we're 10 minutes into the webinar, and it is time to get to the ton of information that we have for you. Of course, academics is the priority. It's the reason why all of our students are here. And to start us off, I'd like to introduce our Provost and Senior Vice President for Academic Affairs to talk for just a few minutes about academics, classes, and the reason why all of our students are here, and the plan for academics for the fall. Dr. Johnson.
Thank you, Dr. Mitchell. Good afternoon, everybody. It's really great to see so many people signed up. I hope you get your questions answered here. We very much appreciate you joining us today. As Dr. Mitchell and President Waldrop mentioned, we will open back up in the fall. We'll have students, faculty, and staff returning for classes to begin August 17th, and check in for residence halls prior to that. Our main goal in developing our plans was to provide an on-campus experience for our students in a way that was as safe as we could possibly do it. And we've taken, and my unit's been responsible for developing the academic plan, and I'll just mention a couple of highlights about that plan, and then we can address more details later in questions. So some of the steps we've taken to protect students, faculty, and staff include, we revised the academic calendar so that on-campus classes will end prior to Thanksgiving, hopefully prior to the peak of flu season, which was our goal there. We eliminated, we're starting the semester one day earlier than originally planned, and we've eliminated fall break. So we've been able to do that by only reducing the total number of classes by 2. Just 2 class days were reduced from the schedule. And final exams will largely be delivered online after Thanksgiving in most of our classes. We've changed the way that classes will be taught to allow for social distancing so that all students and anybody else in the classroom will be at least 6 feet apart. And of course, we will require that masks be worn indoors, including in the classroom, by all participants, including students and faculty. Most of the classes will have to be delivered in a blended or hybrid format. blended and hybrid are synonyms, mean the same thing, where the number of students attending on any given day is reduced so that everybody can stay 6 feet apart. In blended classes, class sessions are still held, but students will attend less frequently. So for example, rather than attending a class 3 times a week, they might attend once per week. And to make up for the additional coursework, that means additional course assignments and assessments will take place online. So the definition of a blended course is that it's a mixture of face-to-face instruction with, in addition, online instruction. And we've taught blended courses for many years at South Alabama. We will just be offering more of them this fall than we traditionally have done. In addition to the blended courses, there will be some classes that will be offered in the traditional face-to-face format, but those have to be very small classes where the number of students can distance the 6 feet apart. That'll mostly take place at the junior and senior level and some graduate classes. And then finally, about 1/3 of the classes will be delivered completely remotely, either in what we call a web online course where there are no scheduled class sessions, or where there are scheduled class sessions, but they'll occur through Zoom meetings like this one. And so that'll be about 35% of instruction. We've also made changes to study spaces on campus. Students will still have places to study on campus, but they'll have to social distance. So we'll be spreading out those spots so that students can stay at least 6 feet apart. So we think by making these changes to instruction, we'll be able to provide a meaningful on-campus experience. Students will still have the opportunity to interact with one another and interact with their professor, but we are making these changes because we're placing such a premium on protecting everyone's health. So that concludes my overview, Dr. Mitchell.
Thank you, Dr. Johnson. Dr. Johnson, of course, the university closed in the spring to in-person classes and really all in-person activity. Do we have any idea at this point if there will be any markers that would indicate what would need to happen in order for that to take place again in the fall semester at all?
You mean what would trigger us moving to fully remote learning again as we did in the spring? So President Waldrop can comment on this as well, and perhaps Ryan Ferguson, but very quickly, the reopening committee has developed a set of criteria that will look at a number of different factors, including the number of infections that occur on campus, the caseloads that occur at hospitals, in the local area, the infection rates in the communities. And the committee meets meets regularly, more than once a week, and reviews those criteria. And when the situation is viewed that the risk of spreading the disease on campus is too high, then we are prepared to make that decision. And I'll open it up to Tony and Ryan if you'd like to. There are many criteria. I just mentioned a few of them. If you'd like to say something else. Tony, you're muted, I believe.
Dave, you covered that very well.
There was also a question that came in earlier this week as we prepared for this webinar about the difference in online, hybrid, and in-person classes, particularly around cost. Is there a difference in those particular offerings as it relates to price? And that may be a question for Mr. Weldon.
Sure. The original courses were listed in the course catalog as being web courses, hybrid courses, and in-person courses. The rates that are being charged were based on that offering. Traditionally, web-only courses are charged at a higher rate than online courses because of the technology and the infrastructure it takes to put them on. So the original plan, the original offering in the catalog is what will continue to be charged. I'll let Dr. Johnson talk about this more if he can expand more, but hopefully there will not be a significant difference between what was planned and what will be offered. I think there will be some shift, but not significantly.
Right. So if a course is listed in the schedule as WO, which is web only, a fully online course with no scheduled class sessions, that's charged the higher tuition rate. If a course if most of the courses are listed as what's called web enhanced WE courses, those are traditionally face-to-face courses. Even if they're converted to blended, they'll still be charged that original rate. So it's essentially we're charging the same tuition rate for this fall as we had for last fall based on how the course is listed in the schedule.
Thank you, Scott. Thank you, David. John, Diana, questions from participants for the academics area?
Yeah, Mike, there's been several questions related to what's going to be open on campus. Will the library be open? Will the student center be open? Rec center? Several questions about the library. And maybe we could get an overview on what the campus is going to look like when students get back.
So I'll speak to the libraries, and then Dr. Mitchell can speak to student center and rec center. With the libraries, they will be open. The stacks will be closed. So students will not be allowed to go in and check out and handle the books on the shelf. What they'll have to do is request that the book be brought by the librarian and delivered to the student. But the study spaces in the libraries will be open. They'll be managed such that in many cases there'll be reservations, but we'll have to make sure that we keep we're allowed to social distance and that we minimize contact. So that's the plan for the libraries. And Dr. Mitchell, you can speak to the other.
Both the student center and the recreation center will be open. The recreation center actually opened Monday of this week. We will have social distancing in place in both of those facilities. The recreation center, as you might imagine, will have some a little bit more strict accommodations in place, of course, due to the nature of that facility. Our outdoor pool at the campus recreation center is going to remain closed until further notice, but the indoor facility will be open. There's going to be some spacing, of course, but the facility itself will be open, and students will have a place to work out and to have some type of normalcy on a college campus. So we are excited that the facility did open this week, and we're preparing for students to start moving in this weekend. We're almost 20 minutes into our program, so we're going to move on to our second phase of the webinar, and that's going to be to talk about where we are in regards to student health, and to talk a little bit about our COVID response, because we know that there are a lot of questions about that. And so Ryan Ferguson and Dr. Julie Estes are actually going to tag team on that a little bit, because they are so interrelated in their work these days. And so Dr. Julie Estes is going to start out first and talk a little bit about the university's COVID response. And then Ryan Ferguson, our director of the Student Health Center, is going to follow her, and then we'll take some questions on that and give you an opportunity to get some of your questions in. And I know I've been seeing a lot of those in our chat, so we're going to try to get as many of those in as we can. Dr. Estes, if you'll start us out.
Sure. Thank you, Dr. Mitchell. As others have said, we are really focused on incorporating the best practices for getting you back to campus in a way that is safe. And it really takes all of us working together to do that effectively. Part of that plan includes testing prior to coming to campus for students. So students on the call, you've been receiving some emails from Dr. Mitchell, also from GuideSafe. Some of you already received your testing information from our partnership with UAB called GuideSafe. And we have testing facilities throughout the state that are providing at no charge to students testing prior to return to campus. So that's one arm of our approach for the return. Another component of that is active screening. And as we return to campus, you'll be receiving updates on this process. But JAG Health Check will be available to all employees and students. And you'll go in each day, if you're coming to campus regularly, you'll go in each day, fill out some quick questions, and it will indicate if you're clear to attend classes and go places on campus, or if you're showing some symptoms or signs of concern, then you'll get a red screen that will indicate, hey, we need to hold off for a minute and follow up with a healthcare provider to see what might be going on. And so that screening process is really important in maintaining a safe and healthy campus environment. The other component that fits into this is contact tracing. So we have a contact tracing office in place to reach out to those who have been in contact with someone who tests positive for COVID-19 on our campus. In addition, we'll be sending out more information about an automated app through GuideSafe that you may have seen this in the news or heard about this. Apple and Android have all been working together to create an encrypted platform that kind of works behind the scenes on your phone. And if you are interacting with people within 6 feet radius for more than 15 minutes, that is stored in an encrypted way in your phone. And then, so for example, if I tested positive tomorrow and I'm using that app, everyone who came within that bubble of mine the day before would get a notification of exposure. And we will be able to offer this to our students and employees as we get that set up through GuideSafe with UAB. It is optional, but strongly suggested that you participate in that system. It's just another way to help keep us healthy, and contact tracing, testing, and checking symptoms are really our three main approaches as we return to campus.
Thank you, Dr. Estes. Ryan, you want to follow up with some information from the student health perspective?
Yeah, so I'll continue a little bit more about the contact tracing. So Dr. Casey Daniel and I created a contact tracing team on campus, and we work with Mobile County Health Department for any outside contacts off of campus. But what that gives us is the opportunity to respond much quicker when we get a reported case on campus. If we had to rely on, the county health department, it could be several days before they get the report and get able to be in contact, whereas we can get in contact with somebody usually within less than 24 hours. So we have a much quicker response time with that. Some of the things student health has done, we've added some positions that are special for just to really kind of get test results quicker, notify students quicker, and be able to give more information out. So we've added a couple of sites on campus that will be able to test students. And with our testing, we will have rapid antigen testing available, and we will also be doing the PCR swabs as well. As a clinic, we offer still our full clinic, but we also have telehealth available. And also our counseling and testing does telehealth as well. So Dr. Friend May can speak on that a little bit. So we have ample opportunity for everybody to be seen, tested quickly. We have the ability to get test results within 24 to 48 hours, which is very good. And hopefully we'll be able to keep that return time, because that's really a big part of the success here, is being able to get the test results early, get contacted early, and just kind of manage any kind of outbreaks that could happen. So we are prepared as well as we can be for that.
Thanks, Ryan. So it looks like one of the biggest questions that has been coming in both here at my office and in the chat box is, I haven't gotten my email yet from GuideSafe. I haven't heard from GuideSafe. I'm getting nervous. So Dr. Estes, can you talk a little bit about the communication strategy with GuideSafe and what students and or parents should be expecting from GuideSafe at this point?
Absolutely. So we have provided the information to GuideSafe on our enrolled students, and they are sending out the email notifications in batches based on the target arrival date. So of course, they are prioritizing testing for students who are arriving to campuses sooner. So if you are arriving early next week or later this week, then you're on that first batch that's going out. So some of you might be coming to campus a little bit later and you haven't yet received that email. So just keep checking your emails, both your regular inbox on your JAGMail account, as well as check your junk and spam folder just to be sure that it didn't accidentally get routed in that direction. And just keep an eye out on that. If it's been a few days, if we're getting toward the end of this week and you still have not received that notification from GuideSafe, there's one route that is going to be your fastest route to information, and that is our One Stop. So here at South, we already had this in place. You can visit the website. It is southalabama.edu/OneStop. They have live chat available. There's a phone number that you can call. That number, if you want to write it down, is 251-341-4USA. So you can call that number, or you can email onestop@southalabama.edu. And they have the latest information. They can check, they'll get your J number and ask you for your email address, and they will check on your status to be sure that your information went from us to GuideSafe and help you navigate any changes with that. But if you know you're not arriving to campus until later next week or closer to time for classes to start, you're probably in one of the batches of emails that is yet to be distributed. So hang tight. We're glad to have that question, because that means that you care about participating in the testing before you come to campus. So keep up that diligence, keep checking that email, and if it starts to be around Friday and you haven't heard yet, go ahead and contact One Stop and we will help you out with that.
Thanks, Julie. And that tip about checking your spam email is a great tip, because my daughter will be a freshman here this year. And sure enough, she checked her spam and there was her email from GuideSafe to make her appointment. So great tip about checking your spam. A lot of our students, of course, have never gotten an email from GuideSafe, and sometimes the system doesn't recognize that email and it sends it to spam. So check that spam, and sometimes voila, there it will be. So any questions from the attendees today, Diana, John, on health and COVID response?
There were a couple of questions about testing for non-residents of Alabama, specifically the home kits. Can you speak to that?
Sure. So basically, anyone outside the state except for, I can't remember what states exactly, Julie, New Jersey, Maryland, there was 2 other ones. Anyway, there's 4 states where they can't get at-home tests, but basically everyone else, if you are outside of the state of Alabama, will get an at-home test. And it's basically the same test that they're giving at the sites. It's a nasal swab that you do yourself, and then you just mail it in. Now, as far as the results, I'm not sure how long that takes as far as the mailing, but once it's received, the results is 24 hours once they receive it. So it should be fairly quickly. And then obviously with that, if there's a time constraint, we can work with you. So contact One Stop on that. We can kind of help you how you can better, you may have to do it here when you get here, instead of doing the mail in at home. So there's options for that.
And if you are an out-of-state student and you are a residential student with a move-in date prior to August the 11th, What GuideSafe went ahead and did on all of those students that were out of state and residential with a move-in prior to August the 11th, they went ahead and switched you to a testing site here on campus because we knew that it was likely that you would not make that turnaround to do an at-home test. And so you likely will get or already have gotten information to register at the testing center here on campus at the USA Mitchell Center. Other questions from the chat box from our attendees on COVID response, student health? Ryan, what happens when a student tests positive on campus for COVID-19?
So there's a couple things with that. So if they test through us, we'll notify the student once that test becomes positive. If they are a resident on campus, then we will work with housing to make sure that they can isolate as needed. And then we will notify contact tracing, who will then begin that process. If they are a non-resident, we will kind of help guide them as far as what they need to do for isolation, and then offer any needs that they may, come up with, as far as food or just any kind of different things that they may need to be basically locked down for 2 weeks. So you're going to have to be able to get food and stuff like that. So we'll help them with that. And again, contact tracing will be notified, and they'll be in contact with students daily to make sure that they're doing okay, they have what they need. So there's going to be contact every single day with these students just to make sure, even the ones that are close contacts, not just the positives, to make sure that they have what they need to get through everything.
Right.
There was another question regarding students who obtained a test in their hometown, but was not through GuideSafe, and they're wondering if that is sufficient.
Ryan, can you take that one?
Yeah. So basically, it needs to be within 14 days of your arrival to campus is one of the main things. And also it needs to be a PCR swab, so a nasal swab. Antibody testing and a rapid antigen test will not be accepted for that. But other than that, what they can do is if they're in that time frame and they got the correct test, they just need to email student health at southalabama.edu and send a copy of that test, and we'll mark them off.
Great. Julie, Ryan, thank you. We're going to move on to our next section, which is a big section. It's our auxiliary section, which includes housing, dining, bookstore, all of the fun stuff that makes campus the place to be. So to cover that particular section, we've got with us again, Dr. Chris Cleveland. And Chris, can you talk a little bit about returning to really what can be the heart of campus, housing, dining, good food, good living?
Thank you so much. I appreciate it. Our move-in process begins this weekend. We are very excited to be welcoming our students back to campus. We did implemented a number of things. Both University Housing and our management partners, Aramark for dining and Barnes & Noble for the bookstore, are committed to the health and safety of our students and the university community. Housing reduced the occupancy and capacity of the buildings by about 300-400 students. We converted our rooms so that over 50% of them are private rooms. We expanded our move-in process, so it will be 9 days as opposed to 1 day on a weekend. We're requiring appointments for those move-ins, and students are being asked to wear masks, even in the residence halls. Even if they have guests over, friends over, we're asking them to still social distance and wear their mask in their rooms. That doesn't necessarily apply for if they have a roommate, as we assume that they will be very close in general. But if they do have other guests over, we're asking that they do that. I think it's really important to the parents to be our partner in helping remind our students to follow these smart things to do. And we appreciate any help and reminders that you can give us for that. The bookstore, if your student lives on campus, we're encouraging all students who are purchasing books from our bookstore to order the books online. They can do so very conveniently through their PAWS account, order their textbooks all there. And if you live on campus, they will be delivered to your residence hall. So if you want to go ahead and get those orders in, you won't have to go to the store. They will bring them over as soon as they're ready, perhaps the following day, to your residence hall for you. So that will cut down on waiting in lines and be a nice service. The dining hall has made significant number of modifications. As you know, there's local guidelines, health guidelines that all restaurants and food service operations have to follow. Our campus is meeting and/or exceeding all of those. I have a really long list of both housing and dining modifications that we are going to be placing on the reopening website no later than tomorrow. It will be booklets, guides that will give you some more in-depth information, but specifically for dining, I want to make sure you know our meal plans begin this Sunday, August 9th. For the dining hall specifically, our retail operations will not open until the first day of class. That's our food court, so Moe's, Panda, Chick-fil-A, on Monday, August 17th. Aramark is our dining partner, and their associates must go through daily temperature screening and symptom checks before they're even allowed to clock in. They're required every 20 minutes to do hand washing. There's physical distancing of not just their employees, but also the students as well if they are waiting in line. There's enhanced signage, again, to remind students to social distance. There's plexiglass barriers around all the foods and at the point of purchase. PPE, the mask and the gloves must be worn by all the employees, and students are also expected to wear masks when they're in the dining hall, of course, unless they're sitting down eating. But even if they wanted to get up and get something, they're asked to re-mask to do that. There will be limited seating in the dining hall. Everything will be packaged to go so that it can be quickly served in case the student wants to leave. But again, possibly up to 50% or possibly less will be available in the residence hall for seating. All the tables will be spaced out 6 feet apart, and the number of students in the facility at any time will be monitored so that they're not exceeding capacity. There's going to be no self-service items at all. Everything's going to be pre-packaged. They'll be able to grab pre-done salads and sandwiches, even the drinks. They won't be able to self-serve drinks. They'll take attendee will serve the drinks to them. Our payment processes are being implemented to be contactless, and remote ordering is planned. That should be in place by the first day of class. And there's going to be directional flow into the dining hall. So one way to enter and get your food and one way to exit. So quite a bit going on there. If you are moving in, or when you move in, bookstore will be open if you would like to visit it. Housing office will be here every day. The move-in process will be such that the student will have received a screening by email, so a screening survey to answer by email. Once they arrive here, they'll be screened at the tent. We're asking that no more than 2 people come to help them move in, and obviously masks need to be worn when they're inside the buildings at all times. they will receive at the screening tent, they will receive their key and move-in information there. So they'll just need to go directly to their hall after their screen. They'll already have their key and then be essentially checked in and go straight to their room. That's generally, I think, what I've got. Questions?
That's a lot. That's a lot. Questions, John, Diana?
Hey, Mike, one of the questions is, can students request a single room? And I'll follow that up by saying, when students are in the dorms, what's the policy on having guests that are not students?
Okay. So we have a minors policy in place. Anyone who is younger than 19 is not allowed in the residence halls this year due to COVID. But other student guests, if they choose to invite them over, again, we're asking they keep their numbers small and make it reasonable that they, however many they have, they can in their physical space social distance appropriately and wear their masks. Yes, we do have single rooms still available. The room change process will take place 2 weeks after move-in. So if students are, maybe they have a roommate right now and they want to get a single room after they move in, just follow the room change request guidelines, and it's on a first come first served basis, but we still have a number of rooms if they want to make that change. We'll do everything that we can to accommodate them.
There was also a question about if a student who lives in the residence hall tests positive, is there a place that will be provided for them to go?
Thank you. Yes, we have reserved a half of the building for quarantine rooms. So if a student does test positive, they will be required to go to a quarantine room and stay, unless they are completely in their own room as it is. Assuming they have a roommate, they'll be required to go to a quarantine room. And their roommate also, who will stay in the room that was assigned, will be required to quarantine as well. And student health will be checking in with both parties. Dining, housing and dining will work together to deliver the 3 meals a day and make sure that students who are in quarantine have enough to eat and don't have needs for that. But we are also advising students to make sure that they pack kind of a bag in case they do have to leave. Be prepared that quarantine is 14 days, and that means no laundry. Things that they need to consider that they may need and grab in a hurry. So please do make that preparation bag in advance and be thinking about that, just so that if student could be prepared.
Dr. Mitchell?
Yes, sir.
Can I follow up real quickly with what Dr. Cleveland said? I just want to let parents and students know that the university offers free confidential counseling. So with students that are quarantined or any students that is experiencing stress, we are offering free confidential counseling through the Zoom platform, face-to-face counseling. The students that we've utilize this with love it. And so I would encourage all parents and students to use that as a resource during this challenging time. Thanks.
Thanks, Dr. Friend.
Other questions for the auxiliaries, dining, housing, bookstore?
There was a question about parents returning the day after drop-off if they need to bring additional supplies.
If they do come to campus, we ask that they'll be given a card that states that they've been cleared for health check, both the students and the parents. If they do come to campus to bring some more things, of course, we ask that they limit their entrance into the building as much as possible. If it's a few things, maybe the student can come get them. If it's very heavy things, then maybe they'll need some assistance. But we are trying to keep as few people in the buildings as possible. So we ask just for your consideration on that when possible.
Thanks, Chris. Other questions that are pressing in the chat for housing and dining? Diana, John? We had a couple of general questions that were posed prior to today's webinar. And the questions came in around the topic of activities and what will activities look like on campus for the fall. And that really falls in my area. And so I'll share that one of the things that the reopening committee for the university has been looking at is gatherings and what will gatherings look like in the fall. And so the reopening committee really has been looking at what the CDC and what the state has been looking at around gatherings. So right now, the state and the CDC have been really looking at groups no larger than 10, and the university also has been encouraging and mandating that groups no larger than 10 gather. So right now we will be encouraging student organizations and those who are in our purview that groups no larger than 10 will gather as far as activities and events in the fall. And so of course that's going to be very, very different for a lot of our student organizations in the fall. So we've started having conversations with a lot of our student organizations about thinking outside of the box in regards to programming, in regards to how they communicate with new students and how they recruit for their student organizations, and just thinking about doing things differently. What the spring and summer have given them an opportunity to do is to think about how to use technology. And so at a time when many of them didn't know what Zoom was, they've really learned and become very proficient in Zoom and have learned how to use it to their benefit. And so we're encouraging them to use that in their extracurricular activities and to, in combination with small in-person events, use technology to complement those small events as well. And so, but we will encourage students to not gather in groups larger than 10 to ensure that we are being as safe as possible here on campus, and also encouraging students to model that same behavior when they're not on campus, because we want them to be safe, not just here when they're on campus, but when they're off campus as well. We also realize that many of our students are commuters and they live in apartments, they're at home, staying at home and commuting. And so we not only want them to model safe behavior when they're here, but also when they're not on campus as well. Other questions coming in from the chat box, Diana, John?
There was a question I should probably direct to Dr. Johnson. There was a question of whether the student will have the option to take their classes online if they're offered in person. Can they opt out and do all of their classes online?
So there are a couple of ways that can be managed. One is the courses. Of course, there are the web-only courses that exist, the fully online courses. There are also a fairly significant number of blended courses where the class sessions are going to be held through Zoom. And so students can go through a drop-add process if they can find a course schedule that would allow them to do the fully online or the blended remote courses. The other thing that's possible is that faculty have been encouraged to develop as many online components to the course as possible for lots of reasons. For example, if a student tests positive and has to go into quarantine, the faculty member will need to work with that student in order for them, as long as they're capable of continuing to work. You know, sometimes students who are positive for COVID are actually asymptomatic or have very mild symptoms, and they can continue to do schoolwork remotely. And so faculty have been encouraged to develop that. And so if a student wants to do the course, they need that particular course and they want to do it remotely, they can email the instructor and see if the instructor can accommodate them. If a student has a risk, an elevated risk for a complication of COVID, or otherwise has any kind of disability that would, where a possible accommodation might be to work remotely, they can also go through Student Disability Services and make that request as well, who can advocate with the faculty member. So there are various ways that this can be approached, either changing the schedule so that they take remote classes, or making a request through either the faculty member or through Student Disability Services.
Thank you, Dr. Johnson. You know, we have talked about the advanced testing of students prior to arriving to campus, but I can't remember if we've talked about sentinel testing and ongoing testing throughout the semester. Have we mentioned that today during the webinar? Can someone talk about sentinel testing and that program for the campus?
I'll speak to that. The Sentinel testing is part of our work with GuideSafe, and basically a small sample of our university community will be regularly tested. So it is voluntary. So folks will be randomly selected from students and employees and ask if they'll complete an at-home or a self nasal swab. So it'll be a simple test that you do on yourself. And then that helps us gauge what's going on in our campus community in terms of positive COVID tests. Ryan, is there anything you'd like to add about the testing and how it gives us a big picture view?
I mean, it's basically a voluntary testing, so you will have to sign up for it. It's not mandatory. It will include faculty and staff as well. So it gives an entire global view of the university, not just students. So how often we do it, still undecided. So could be a few times a semester. It could be every 2 weeks. It just kind of depends on what's needed as far as monitoring. So I think that's it.
I know that we have some resources as we get close to the end of our hour that we wanted to share with you all as parents and students, so that if we didn't get a chance to get to your question, there would be an opportunity for you to possibly go to some of the resources to find more information. And if you thought of a question after today's Zoom webinar, you might be able to go to these resources and find the answers to your questions. Diana, do you have some information to screen share with the attendees today?
Yes. I am going to share the reopening website that is available. Can y'all see that on my screen?
Yes, ma'am.
southalabama.edu/reopening, and that should have a lot of information that covers some of the questions that were in the chat box that we couldn't get to. You should be able to find everything that you need there. In addition, we will be posting a video of this meeting on that website in the next couple of days. So if you need to review and go back, if you missed something, you can go back to that website and find it.
Thanks, Diana.
Sure.
Dr. Cleveland, did you have some additional information on housing as well that you wanted to share?
We're going to put that on the reopening website tomorrow. It will be a guidebook for both housing and for dining. So be looking for that. We'll also email those out directly to our students who live on campus, so they'll have copies as well.
Thank you. I know many of you are sending a student off to college for the very first time, and many of you will have those students living here on campus with us. We appreciate you trusting us with them, and we are getting ready to welcome them to JAG Nation. So I know that some of you may have a couple of butterflies, and I have worked in higher education now for, I can't believe it, over 20 years. And this is the first time in those over 20 years where there's not been a traditional summer orientation. And we've been able to have parents and students on campus and answer questions and let you touch and feel and see. And so this is a very, very different time for students, but we know that it's also a very different time for parents. So we appreciate you being on this Zoom with us today and giving us an opportunity to answer your questions. And so today we've had upwards of almost 400 folks on this call today. I know a lot of them have been students, a lot of them have been parents, and we hope that this has been helpful for you. And if you've had questions, we hope that we've been able to answer some of them, if not all of them. And if we've not been able to get to all of them, we hope that we've given you a resource this afternoon that will help you get to the answers that you need. If not, I'm going to give you the email address for my office, studentaffairs@southalabama.edu. Feel free to shoot an email to that email address, and we will try to get you the answer that you need, or get you to the folks that can get you the answer that you need. Ultimate goal, we want you to feel as comfortable as you can before the first day of classes. So send us your email, send us your questions, and we will get you taken care of as best we can. So we like to think of this whole effort as a team, and we hope that we are all on the same team getting your student to graduation. It's a long process, but it goes faster than you think it will. Folks, we thank you so much for your time this afternoon, and we hope that this has been helpful and productive for you. We're looking forward to seeing you, can't believe it, in a couple of weeks for first day of school. And some of you will see you this weekend because you're going to start moving in. So thanks again for your time. Thank you, Dr. Waldrop, for being here. And thanks again for your leadership. Thanks to all of you who've been on our panel today. And thanks again, Diana and John, for helping to put this event together. Have a wonderful rest of your week and a great weekend, and go Jags. Have a great day.